Hello, hi, and welcome to Kaplan's Pre-Med Day. We are so excited to have you here. I am Kaplan Teacher Jed, and we have a whole wonderful lineup of folks from all over that want to talk to you today about their journey to becoming doctors and what it's like to be a doctor and what it's like to be in med school and how you should take a gap year. And we got a wonderful group of topics for you. Thank you so much for joining us today. We also have some experts here in the chat that would happily answer any and all questions that you have as they can. There are more of you than us, so be a little patient with us, but please participate as much as you are able. You'll get a lot more out of the day that way. But I am so excited. I am so excited. We've got Dr. Dale Okorodudu here to talk to us, and I don't want to waste any time. So Rockstar on the way, and we've got a little short intro video for those of you that don't know Dr. Dale yet. I think you are going to be very excited indeed. Let's go ahead and start by rolling that tape.
Things as malignancy.
I mean, this is cancer. I guess this could be lymphadengitic spread.
My name is Dr. Dale Okorodudu. I am the founder of Black Men in White Coats, and I'm a pulmonary and critical care physician practicing at the Dallas VA Medical Center. I absolutely love what I do. There are very few jobs in the world where I think you kind of get most of what you want in one package. I was raised in League City, Texas, which is just outside of Houston. Academics were very important to my parents. I always tell the story about one time when I came home and I said, "Hey, Dad, check out this test score. I got a 98%. And my dad looked at it. He said, "What happened to the other 2 points?" Even though he knew I gave him my all and he was happy with the 98%, he was making a point that, son, if you can do better, do better. Honestly, I don't remember pretty much anything in high school except for playing basketball. And when I got to college and realized that basketball wasn't the path that my life would take me, my focus shifted to academics. I was a biology major at the University of Missouri. I went to the University of Missouri for med school as well. Did my residency at Duke University Medical Center in Durham, North Carolina, and fell in love with the program at UT Southwestern, where I did my pulmonary and critical care fellowship. There are numbers as low as 2% of all physicians are African-American males in medicine. If you don't have very many Black males in medicine for you to see, for you to emulate, for you to get mentorship from, it becomes difficult. In 2013, the AAMC came out with a report highlighting the decrease in number of Black men applying to medical school, and we thought there's got to be some way we can contribute to this. We set my cell phone up and we actually filmed the very first Black Men in White Coats. Had a great welcoming online, tens of thousands of views. And then we've since filmed multiple episodes of Black Men in White Coats. There's this belief that as a Black male that you can't go talk to a physician, and often that you can't go up and talk to a Black male physician, but Black Men in White Coats is helping to shatter that belief. So now they come to us and say, "Hey, can you come talk to us? Can you come talk to my children? Can you come talk at my school?" To let them know you can become a physician if that's what you really want to do in life. So that means she hit her leg. That's one separate thing, and then she still has a different condition here. I used to go in the ICU and I would see patients like this and I would freak out because that's intimidating. When you walk in the ICU, people have all these lines and tubes in them. The most rewarding part of my job is knowing that everything that I've learned, I have the ability to pass back to teach other people so they can go on and teach other people.
And with that, I present Dr. Dale Okorodudu.
Morning, good morning, good morning. Super excited to be here today, Kaplan. Thanks for having me. I'm really happy to be here this morning. So really, really excited for you all and for the day you're going to have and all the exciting things you're going to get to see and learn and hear from the people you get to hear from is going to be great. I just want to kick it off for you guys really fast with just a few thoughts and a few questions for you to think about. Here's the deal. When you're a pre-med student, they're always talking to you about be a holistic student, and they talk about the holistic application, the holistic review process. So in pre-med, you're running around, you're trying to do a little bit of research, a little bit of shadowing, you're trying to make sure you get the grades, trying to do whatever you are. You're trying to be a well-rounded pre-medical student. But I was thinking about it the other day. What does that translate into as a medical student, as a resident, as a fellow, and then as a doctor? There's so much emphasis on you all to be holistic pre-medical students, but what about the holistic doctor? What about the holistic physician? What about doing things beyond just being in the operating room, or for me, I'm an ICU doctor, beyond just being in the ICU? How do you become a holistic physician? One of the questions I get asked most often is, "Hey, Dr. Dale, how do you do all those things you do? You do so many things. You're a full-time doctor. You do pulmonary critical care. You do all that stuff. You do a lot of teaching and stuff at the medical school. How do you do all that? Oh, you just made a documentary video. How'd you do that? Oh, you write books and stuff. How do you do that, Dr. Dale? Oh, by the way, you've got these tech companies and startups, and you're a husband and a father, and you coach your kid. How do you do all that, Dr. Dale?" My answer is I try my best to be a holistic physician. I think about myself as more than a doctor. Life is bigger than medicine. Life is bigger than medicine. So that's what I want to talk to you all about here briefly this morning, just 10 minutes or so. I'm going to ask you all some questions. I want you to go ahead and grab your pen, grab your paper, and write these questions down so you remember them, so you can approach your career like this. So when you're 10, 20 years out from today, you'll still be able to be a holistic individual. The first question I've got for you to think about. Question number one, write it down. What is your professional mission? What is your professional mission? Here's the deal. A lot of us just kind of get into medicine and we just start, following the trend, right? You're pre-med, you're going to be pre-med for X amount of years or whatever. These are the classes you need to take. Then you need to apply. Then you go to med school. Then you take your board exams and then you apply again. Then everything is just so regimented for you as a pre-medical student. It's almost like they can put you on a conveyor belt and they move us right along this process. But how often do you actually ever stop to think, okay, what is my professional mission? What do I really want to do for my life's work, my life's career? What do I want to do? And here's what I want you all to understand. There's a difference between having a job and work, right? God gave us work. Work is what am I here for? Work is in me. Who am I? What am I here for on this earth to do? That's my work, right? A job is something you go to, you get some money for it, and you get to go back home and you can forget about it. But you can't forget about your work. Your work is part of who you are. Okay. So the first question I want you all to think about when it comes to being more than a doctor, being the holistic doctor, right? Thinking bigger than medicine. First question is, what is your professional mission? I'll tell you, my professional mission is to develop tomorrow's leaders in medicine. That's what I focus on. Everything I do focuses on developing tomorrow's leaders in medicine, and I approach my days through that lens. This is my professional mission. Of course, I've got a bigger mission, a life mission that includes my family life too. But just from a professional standpoint, develop tomorrow's leaders in medicine. So everything I do, you all saw the video just now, the things I do all go through that lens. Is this helping me develop tomorrow's leaders in medicine? So that's the first question you have to ask yourself. What is your professional mission? And we do tons of work with pre-medical students. And one of the things that I have the pre-meds I work with do, I say, what is your pre-medical mission statement? So I want them to start thinking like that, right? So thinking as a pre-medical student, who are you? What is your work as a pre-med? What is it about? What is this really about for you? And then expand that out to your professional. So that's question number one, write it down. What is your professional mission statement? Question number two for you to think about is, what things do you need to accomplish to fulfill that work, to fulfill that mission statement? Here's how I like to think about it. Imagine you got a big bag, just a big sack, potato sack or whatever. And that big bag, that big sack is your work. That's your mission statement. That's your life's work, your professional work. That's everything. What things do you need to dump into that bag? What other accomplishments do you need to dump into that bag to fulfill it, right? So again, for me, my professional mission statement is to develop tomorrow's leaders in medicine. That's my big sack, my big bag. What am I putting inside of it? Okay, I'm putting my books inside of it, right? I'm writing these books. That's part of me meeting this life's work, this professional work. All right, I put my documentary inside of it that we just made. What else can I put in? Okay, we run summits across the country. I put my summits inside of that bag. All right, what else am I gonna do? I teach at the medical school. I put all of those things inside of that bag. At the end of the day, that bag needs to be heavy. I want that bag to be so heavy that the Santa Claus couldn't pick it up, right? I want that bag to be really, really heavy because I filled up my work, my professional mission statement. I filled all that up with little accomplishments inside of that bag. And when you add all that together, it makes for a heavy bag. It makes for a well-fulfilled career at the end of the day. That's my goal. That's what I'm going for, right? And all these things are helping me be well-rounded because if you think about it, it's not as if I'm just practicing pulmonary critical care medicine. That's fine. I love it. That's part of it. But on top of that, I want to be a holistic doctor, right? I have a bigger mission and I know what I want to do. And if you don't know what you want to do, somebody's going to tell you what you want to do. So it's really important that you for yourself figure out what do you want to do, okay? So I'm just dumping all these things in this bag. And at the end of the day, I'm hoping that I meet that professional mission statement. So question number one, what is your professional mission? Question number two, write these down, guys. Don't forget them. is what things do you need to do to accomplish that, to bring it to fruition, okay? Number 3, this one's critical. I really want you to pay attention to this one. So critical, and this is where a lot of people drop the ball. Number 3 is, who do you want to accomplish those things with? Who do you want to accomplish those things with? So, hey, if you're like me, you've got a whole lot of things you want to do in life. You've got a whole lot of things you want to accomplish in this professional career over the next, I finished all my training at 32 years old, right? So I've got another, on top of that, maybe another 40 years or something in the medical field, right? So who do I want to run this journey with? There's an African proverb that goes, if you want to go far, let me start over that one. African proverb that goes, if you want to go fast, go alone. But if you want to go far, go together. I'm gonna say it again. If you want to go fast, go alone. But if you want to go far, go together. And that is so true. And I found it to be so impactful in my life. So I'm gonna give y'all some gold. Write these down. This is gold. This is jewels, right? These are game changers if you actually apply this to your life. Almost everything I start, right? So anything you've seen me do that's got Dr. Dale's on that I've done, I started it by myself, right? Meaning I started alone so I can go fast. I wanted to move. I wanted to go fast. Because up front, sometimes you just need to go really fast. You got to get the ball rolling. It's a snowball. You want to get that snowball going, build that momentum, right? But then I always get to a point where I say, wow, okay, this is cool. We've done some good stuff. However, I need this thing to go far, right? I don't just want to have one summit. I want to have a lot of summits. I don't just want to have one book. I want to have a lot of books. So who do I start bringing on my team with me so we can go far, right? Because I want it to go far, because at some point in time, there's going to be things that I can't do anymore. And the question is no longer, hey, how do I do this? The question becomes, who do I know that can do this? Okay. So easy. One of the biggest questions is, Dr. Dale, do you sleep? How do you do this? How do you do that? Well, it's because who I brought on my team with me. I brought people who were strong, who can execute, and they helped me go far. And because of these people on my team, I get to be the holistic doctor that I want to be. And when I say holistic doctor, guys, I don't mean practicing holistic medicine. That's cool, but I'm talking about a well-rounded physician that can do more than take care of patients in the clinic or in the ICU room, right? Right. So the people around me, who do you want to accomplish with it? So question number 1, what's your professional mission statement? Question number 2, what things do you need to do? What things do you need to accomplish to bring that to fruition? Question number 3, who do you want to accomplish it with? Question number 4, how can I become a better leader? Question number 4 is, how can you become a better leader? And this is another one that people miss out on so much, is people just think that they can go through life and just figure out how to lead on the fly. No, it's like that song, there's levels to this thing, right? There's levels. You've got to prepare, you've got to study, you've got to work hard. You see my bookshelf behind me. If you were to go through all those books and all the books I've got in my Audible app on my phone and my other bookshelf over here, a lot of them are leadership books, your books that I read to train me how to become a better leader. And it's important to be a better leader because of question number 3. Who do you want to accomplish these things with? So when you have a team, you have to know how to lead the team. When you have the team, you have to know how to lead the team. So I spend quite a bit of time preparing myself to be a leader. I spend quite a bit of time working on my communication skills. I spend quite a bit of time learning how to build things, how to build businesses, how to write books, how to make films. All those things we do, right? I focus on those things. I take the time to learn how to be a leader. All right. The question number 5 is, when can I stop? When can I say, you know what? I'm done. My work is done. I've been that holistic professional. I'm done. When can I stop? That's a question you're going to have to answer for yourself. I can't answer that question for you. I'll tell you, for me, when I die, I don't want to die anytime soon. By the grace of God, I got a lot of years on me. I want to die on E. I want my gas tank to be on E, right? That's who I am. That's what I want for myself. But you will have to answer that question yourself. You have to answer that question yourself. When can you stop? All right, that's what I got. Let me recap those 5 questions for you all. I hope you wrote them down. Number 1, what is your professional mission statement? What is your work? What do you want to do? Number 2, what things do you need to accomplish to bring that to fruition? Number 3, who do you want to accomplish it with? Number 4, how can I become a better leader? And number 5, when can I stop? All right, guys, I hope you wrote it down. I hope you let it sink in. And before I go, we got one more video to show you, okay? I mentioned the documentary a few times in this. We just finished the documentary. It's called Black Men in White Coats. It's getting amazing reviews. We're super excited about it. Took a long time and a lot of work to make it. But I would love for you all to see the trailer. So my friends at Kaplan, I would ask if you guys could cue that trailer up so everybody can see. Thank you all, and I love you.
We need more black men in white coats because we need to save the lives of more black men, period.
There were fewer black men applying to medical school in 2014 than in 1978.
There are several medical schools that do not have any black men in their classrooms. When that is the case, and we're in a learning environment, there's going to be different conclusions made about how to care for people if there are not diverse people around the table.
You need to care about your fellow man and woman, otherwise we all suffer. So the reason why white people, white women should care about diversifying the physician workforce, which includes black men, is because it makes it better for all of us.
Historically, the system wasn't designed for black men to succeed.
My mom, on and off drugs, in and out of jail my whole life, and becoming an orthopedic spine surgeon. If I can do it and come from that environment and everything that I went through, I think you can also.
There are little black boys out there who see me on TV, who see me in this role, and who may not have ever thought that they could be a doctor, much less Surgeon General, who when they see that, all of a sudden think, I can do that too.
We're approaching this as though it's a problem versus realizing that we have a crisis on our hands.
What's the impact if this problem doesn't change?
Black people are gonna continue dying.
Yeah, ain't no time for stressing, I've been really stacking. Ooh, ooh. Yeah, if you wanna go get it, stop playing around. Really got on Rex, ain't playing around. Wanna go get it, stop playing around. Really got on Rex, ain't playing around. Black men, white coat, shit, we up right now, yeah. You gotta set you a goal, you gotta accomplish your goal.
Are you so pumped? Oh my goodness. Oh my god. I don't know if we can live up to that standard for the whole day. Thank you so much, Dr. Dale Okorodudu, starting us off with a huge bang. We are really excited about the work that he is doing and his film, and I hope you are too.